Thank you, Madam Speaker. I thank the gentleman for yielding. I thank Mr. Hoyer for his leadership on this very important legislation. He has worked very hard to try to achieve a level of bipartisanship on this legislation that could override the President's veto. In the United States Senate, there is a bipartisan majority, a substantial bipartisan majority, large enough to override a President's veto. I hope that we could achieve that in this House. We are not going to take up that vote tonight, as has been indicated by Mr. Hoyer. That debate and that vote will take place on January 23rd. It's just very interesting to hear the reasons why the President of the United States said veto.
Madam Speaker, the House is not in order.
Why the President of the United States said veto to the children of America. Veto in Latin, I forbid. I forbid the children of America, the children of working families who play by the rules and want the best for their children, who are struggling to make ends meet and who need health care, and the health care that keeps them in the workforce and off of welfare and off of Medicaid. Madam Speaker, it's particularly interesting to hear this when we're in the debate on the omnibus bill, where there's talk of billions, hundreds of billions of dollars more for the war in Iraq. For 40 days in Iraq, we can ensure 10 million children in America. 40 days in Iraq, 10 million children in America. This is not an issue. This is a value. This is an ethic of the American people. Democrats and Republicans, people of no party affiliation, everybody cares about the children of America. Over 80% of the American people support the SCHIP expansion that we want to do, to double the number of children. The President said we have not. He's moving the goalpost. In his first veto message, he said he's concerned about the fact that people making $80,000 would be eligible for SCHIP. Not so. The only way they could be eligible is if the President of the United States himself gave them a waiver. The President has given waivers to families making 300% of poverty. The President himself has given that waiver, and now he's complaining about that level of income for families, hardworking families, to receive SCHIP. The President said he's concerned that there's still adults in the program. The Democratic response, bipartisan, strong with 45 Republican votes, said that the adults will be phased out. The reason some of them are there in the first place is that in order to get the children into the program, governors had thought that it would be important to bring families into the program, and the President of the United States, President Bush's policy, allowed that to happen. So he's turning his back on his own policy. He's turning his back on these children by saying their families should be off of SCHIP. So when the President says, oh, he's opposed to the bill because it raises taxes, then we get to the heart of the matter. This bill is paid by an increase in the cigarette tax. And this is really why the President is vetoing the bill. The President is saying that rather than raise the cigarette tax, he would prefer to prevent an additional 5 million children in our country from getting access to quality health care. The President has also said in other comments about this legislation, everyone in America has access to health care. They can just go to the emergency room. Probably with one of the most ill-informed, with stiff competition for that honor, but nonetheless, probably one of the most ill-informed statements by anyone dealing with public policy and access to health care. So, again, I think all the members of Congress who voted for this in a very strong bipartisan way in the House and the Senate can take great pride in setting a high water mark for what this Congress should be doing for children of working families in America. I salute Mr. Hoyer, Mr. Dingell, Mr. Rangel, Mr. Pallone, Mr. Stark for their exceptional leadership. I also salute Mr. LaHood for what he tried to do to bring bipartisanship to all of this. And I commend Senator Grassley and Senator Hatch for their courageous leadership in the Senate in leading the way to a veto-proof majority of Democrats and Republicans in the United States Senate. Whether you're talking about Easter seals or the March of Dimes, the Association of Catholic Hospitals, AARP, AMA, to YWCA and everything alphabetically in between. Everyone supports SCHIP except the President of the United States and those in this body who will side with him on this vote. What a sad day. What a sad day that the President would say, rather than showing 5 million children, I don't want to raise a cigarette tax. What a sad day when we would spend in 40 days in Iraq what it takes to ensure children in America for 1 year. But we are not going to let this veto stand. We will act upon it, and we will continue to fight the fight until 10 million children at a minimum in America have access to quality health care under the SCHIP program. It is the wish of the governors, and I yield back the balance of my time.
Gentlewoman yields back the balance of her time.